Hello viewers out there, this is another time to celebrate World Glaucoma Week. This week is celebrated all around the world every year. For this year, the theme is Uniting for a Glaucoma-Free World, and the date is between 9th and 15th of March 2025. And the emphasis is on collaborative efforts on how to nip in the bud this menace. It is the silent thief of sight. So let's come over and listen to what the expert has to say about this issue. So we are going to be having with us Dr. Oluwaniyi Ajibola, the resident consultant ophthalmologist at the Redeemers Health Center. I am Ajibola Oluwaniyi, your ophthalmic nurse. You're welcome back, viewers, and I'm happy to have with me, like I said, Dr. Consultant, Dr. Ajibola. How are you? Nice to have you on.
I'm fine. I'm good. Thanks for having me here.
All right. So let's go to business. In simple terms, what is glaucoma?
So glaucoma is the commonest cause of irreversible blindness worldwide.
Okay.
And it usually starts by damaging an essential structure in the eye. And this part of the eye is essential in connecting the eye to the brain. It transmits information received from the eye, transmits it to the brain. And so it's an essential part of the eye.
So is that why it is called the silent thief of sight?
So it is called the silent thief of sight because glaucoma is usually asymptomatic, meaning most patients present without symptoms. So by the time patients notice symptoms, the damage must have been far gone.
Yes.
So, but in its early stages, most patients don't have any symptom like redness, pain, discharge, or anything. Most patients don't have such. In fact, if it is detected early, it is probably because the person presented to the hospital for something else or for an eye examination.
Wow, that's it. So how does it affect vision? We want you to enlighten our viewers out there how it, since it doesn't you can't really lay hold on it that this is glaucoma before it even starts and aggravates. So how does it affect vision, and how can it be reversed if it starts early?
Okay, thank you for that great question. So usually glaucoma, like I mentioned earlier, is asymptomatic. So usually when it starts, nobody really knows except for the patient presenting to the hospital, and then the eye examined, and then it is picked up. So usually glaucoma is insidious, meaning that it starts gradually and it is progressive. So over 10 years, the person may have glaucoma and may not even know he or she has it.
Wow.
And so gradually it damages a particular nerve in the eye called the optic nerve. And like I mentioned earlier, the optic nerve receives visual information from the eye and sends it to the brain where it is being interpreted. And that is how you know what you are seeing. So, but glaucoma damages this vital structure in the eye and it results in blindness.
So that is why it is irreversible, because it is a nerve injury.
Yes. So unlike most nerves that can recover over time or regenerate, this particular nerve does not regenerate because it is an extension of the brain.
Wow. So that's even what makes it worse.
Yeah.
So let's move on to the next question. You know, most of the risk of developing glaucoma are numerous. We want you to just itemize them in few words.
Okay, so the common risk factors, I'll just dwell on the common ones. Being black is actually a risk factor.
Wow.
Because it has been found to be more amongst blacks compared to other races.
Blacks as in fair-skinned or race?
Okay, so when talking about blacks now, we are referring to Africans. Or people of African descent. So African Americans, for instance, are also part of this group. And so that is one. So secondly, the older you get, the higher the risk of developing glaucoma. So increasing age is a risk factor for glaucoma. So greater than 40 years and above is at risk of developing glaucoma. But that is not to say that younger people cannot also have glaucoma.
That's it.
So then secondly, family history is a very important risk factor also.
That's genetics.
Yes, genetics. Okay. So if you have someone in your family who has glaucoma, the risk is higher for you. So for such people, they need to go for routine eye examination just to be sure that they don't have it or it is detected early. So other risk factors, cardiovascular diseases such as hypertension, diabetes, for instance, are risk factors for glaucoma. Then refractive errors like myopia, hyperopia are also risk factors for glaucoma.
Okay.
And so many others.
All right. So having said this, how often should anyone go for an eye checkup, since you can't really say this is glaucoma coming and I want to arrest it? So is there a regimented time that you have to follow through? Examination, you have to do it. Probably is it yearly basis or biannually, or just enlighten us on.
So usually we advise that people go for eye checkup at least twice a year. So that is yes, so twice standard. A year, 6 monthly. Okay. That's the standard.
What if there is a higher risk?
So if you have a higher risk, you may need to present more frequently, say about 3 times or thereabout. But basically for everyone, at least have your eyes checked twice a year.
I think we are all hearing that. Have your eyes checked at least twice.
Yes, this is something we don't routinely do.
This is something we don't do routinely.
Yes.
We don't even get to check our eyes until probably something happens.
Yes.
I need help. So you need to do that. I hope you've gotten that. So let's move on to the next question. Everybody's talking about lifestyle. Anywhere you move to, you hear lifestyle. So are we saying that lifestyle also affects glaucoma and the choices we make?
Yes, because like I mentioned earlier also, when I talked about cardiovascular diseases like hypertension, diabetes, and these things are influenced majorly by our lifestyle decisions.
That's true.
And because especially now there's a lot of westernization of lifestyle and all of that, we tend to have an increased development of all these cardiovascular diseases. So yes, lifestyle is very important. Eat well, sleep well. Stress also can indirectly, lead to a progression in glaucoma.
Yes.
So yes, it is very important. And then migraine also is actually a risk factor for glaucoma. So there are so many risk factors really. So yes, your lifestyle determines how
the progression.
Yes, the progression of glaucoma.
So you've heard it, viewers, and each and every one of us, please make sure you are on top of your game. Eat well, eat healthy, choose your
balanced diet.
Yes, choose it. You must be you should be intentional about anything that comes into your mouth. So what are the common treatment available in nowadays? In this our time and season, what are those options that we have to treat glaucoma?
Okay, so first I would say that there's really no cure for glaucoma.
That's sad.
But it is treatable. And the various options, usually we start with medical treatment, but it is not limited to that alone. We also have the surgical treatment.
Okay.
We have, under surgical, we have what we call trabeculectomy, tube shunt surgeries. We have minimally invasive glaucoma surgeries nowadays. So innovation is always ongoing.
That's good.
And then we also have the laser treatment too. So your healthcare provider, the specialist, will be the one to determine what fits your eye condition. And so if there's a need to go for surgery, please do. Very important.
So can you please give us can you debunk some of the myths that comes with the treatment of glaucoma, or probably the things that people think about, this is it and this is not it? For example, some people say, I can see clearly, so I don't think I can have glaucoma, isn't it?
Actually, that is a very common myth, which is actually a misnomer. Because just because you can see clearly doesn't mean you can't have glaucoma. Like I said, glaucoma is asymptomatic. So in the early stages, you won't know you have glaucoma except you go for an eye checkup. So it's possible to be seen clearly. It's possible for you to see the whole world and still have glaucoma.
Wow.
So it is only when it gets to the late stages, advanced stages, that is when you start to notice that there's a problem. So even if you see clearly, please go for an eye checkup.
I remember another one is no member of my family has it, so I don't think, probably they think it's contagious. Anyways, we've heard it that it is genetical, so you can get it from one family member. I mean, the stream, maybe father or mother. So does it mean that if no one in the family has it?
So it's a two-way thing, because when people say that, I always tell them, did your parents go for eye checkup when they were much younger, or when they were alive? Because some people say, they are dead and they could see clearly. My mother can see clearly, but did they go for eye checkup? You don't know.
Yes,
exactly.
Sure.
Exactly. So you can't be too sure. And then your grandparents, did they go for eye checkup? You know, you never can tell. And then secondly, there are so many risk factors. So it's not just the family history or the genetics that accounts for the risk factors of glaucoma. So there are so many, you can't just...
So you are trying to tell us that not just the elderly can suffer from glaucoma. Is that what you're saying?
Yes. So we have younger ones also present. In fact, we have babies presenting with glaucoma. That is what we refer to as congenital glaucoma. And so we have the juvenile glaucoma, which is found in less than 40 years. We can have young people presenting with glaucoma. So it's not just limited to the elderly.
So having said all of this, does that mean that anybody that has glaucoma will go blind eventually?
So in this part of the world, we have so many people coming in with blindness. Unfortunately, this is because we don't go for eye checkup. In the Western world, many of them don't go blind because they come in early for checkup. You know, there's always a routine eye examination, either at their workplace or something else or something like that. So they come in early, it is picked early, it is detected early, and treatment is started early. So, but in this part of the world, we don't go for eye checkup. And so many people come in when they are blind, either blind in one eye or blind in both eyes. Yes. And most people don't even know they are blind in one eye, unfortunately.
Yes.
Because we don't cover our eyes to see. Am I seeing with both eyes?
So
most people will say, I didn't even know.
We get too busy with our day-to-day activities without even checking ourselves. Please check. Can you see in one eye? Quickly do that check. All right. So, but it is now, you know, we've talked about glaucoma being insidious, you know, not being able to capture it until, you know, you come for a test in the hospital.
Yes.
But having said all of this, and then you have started treatment, following through the treatment, and it doesn't improve, are they supposed to continue? Because that's what some people would say, that I've been using glaucoma drops and I can't see any improvement, so I stopped it. So what is your take on that?
So yes, like you mentioned, many people say that, and then unfortunately they come in blind. So the treatment of glaucoma is not to cure it or to reverse glaucoma. Is actually to prevent it from getting worse. So you're using the eye drops or whatever treatment you're undergoing is not to improve your vision. It is to prevent it from getting worse. So if you start an eye drop, it's not going to cure it or make you see better. It's just for you to maintain what you are seeing presently. And that is why early detection is very important. So that you detect it when the person can still see well, and then you can maintain that vision as much as possible. So please don't ever stop your anti-glaucoma medications. People that stop it usually come in blind.
Sincerely, that's a very hard truth to swallow.
Yes.
That you are using your glaucoma drops, it does not improve your sight, but you still need to continue. It's sad, but that's the truth. Please continue and make sure that whatever sight is remaining is preserved, at least till your old age. So let's go spiritual now. Has it been associated to spiritual issues? I mean, glaucoma. Can we attribute it to, probably you don't need to treat it, or just go spiritual and then you'll be fine?
That's an interesting question. So even the Bible says that in all thy getting, get wisdom. And wisdom is profitable to direct. Yes. So yes, as spiritual beings, many people tend to attribute so many things to spiritual attacks and all of that. But glaucoma in itself is not a spiritual problem.
Did you hear that?
It's just an eye condition, an eye disease that starts insidiously. So most people, when they are blind, they think, it is someone that did this to me. No, in fact, I had someone that was actually arguing it out that, no, this person did this to me and all of that. And I'm like, you have end-stage glaucoma. There's nothing relating to spiritual attack here. And like we said, it must have started long before that time when the person was seeing, but nothing was done. So it's not a spiritual disease. So I pray God will help us all.
Amen. So let's move on to another subject matter. Some people, we've been hearing about herbal concussions, people talking about medications relating to herbs, is working like anything. So what do you think about herbs? What's your...
So yes, like you mentioned, we have so many patients calling in to ask about one drug they saw online, one herbal mixture that was promoted online.
It works wonders.
So I'm just going to say that many of those things are fake, actually.
Did you hear
that?
There
are so many desperate Nigerians trying to make money, and they will do anything just to make that money. So please, when you get all these things, at least even before you procure anything, you can ask a specialist just to find out. But most of those things they promote online are fake. So better to go to the hospital, get yourself examined and treated, because most of these treatments have been researched before putting it out. So it's not as if someone just thought of it and then it just started working. No. It has been researched over time and proven to be successful.
We are all in the world of gadgets, screen here, screen there. It's like a menace or something that we have come to live with, whether we like it or not. So the bitter truth or the truth about it, we want to know if it directly affects causation of glaucoma or progression of glaucoma, or what is your take on it?
Okay, so increased screen time, especially for children, has been found to lead to an increase in the development of myopia.
Yeah.
Which is a risk factor for glaucoma.
Yes.
So that can be attributed to, and so we can say there's an indirect link between screen time, and because it will lead to myopia, and myopia is a risk factor for glaucoma. So in everything we do, yes. So we have to, try to control or limit the exposure of these innocent kids to all these gadgets, screen time and all of that. Yes, we know we are in the IT age and most of the things are done online and all of that. But yes, we have to ensure control.
That takes us to importance of health education and awareness. How important is health education and awareness concerning the subject matter? Because we know that when you are not informed, you are deformed already. So what is the essence of education in...
So education does a lot, actually. Like this World Glaucoma Week is also to sensitize the public on glaucoma and the effect of glaucoma, which is blindness. And so the hope is that the more people you sensitize, the more you are able to control that disease, at least reduce the rate of blindness as a result of glaucoma, because it is the people that know about it that will be able to take action. Actually, illiteracy is a risk factor for glaucoma.
Yes,
especially in this part of the world. It has been researched.
Yes,
because if you don't know, if you are not aware, you won't know what to do. So awareness and education improves detection of the disease. And also, even when you start your treatment, patient education is important because the patient is able to understand what you are trying to achieve, and so compliance is better.
Rounding up, let's just talk about what is the take of the community. How should we respond as a community, a people, to the treatment of glaucoma, accepting the people around us, and what's the function of the community
Okay, so
in the treatment of glaucoma?
When it comes to glaucoma treatment, most of these patients need support.
Yes.
So social support and all of that. You don't want people stigmatizing against you, as in you don't want people distancing themselves just because of one thing or the other. So most of these patients need support. So even if they are blind, as a community, rehabilitation is important.
Yes.
You know, when you come together to show love to people, because at the end of the day, we are all human.
Yes.
And nobody asked for it. Nobody wants to really have glaucoma. You understand? But you have people that are blind for it, and you should show love to such people. Be there for them. So if you have family members that have glaucoma, they need your support, they need your love. Actually, most of them go through a lot. You know, blindness is not an easy thing. I pray we don't experience it in Jesus' name. And blindness is not something you want to experience.
Not even for your enemy. Won't even pray
for your enemy.
Blindness for your enemy. So thank you so much, Dr. Oluwaniyi Ajibola. This time with you has been so enlightening, and thank you for the wealth of knowledge. You've heard it, all viewers out there, that this is what glaucoma is and this is what is not. You have heard that it is a silent tip of sight, is insidious in onset, and it progresses, and you need to check your eyes at least twice a year to be sure you don't have it. And being that your mom or your father didn't have it does not mean that you cannot have it. It can also happen in children. And then the treatment regimen is that you should come to the appropriate place or the clinic to get tested and be treated for glaucoma. And remember, it is not reversible. That you are on treatment does not mean that it's going to improve the sight, but you need to continue on whatever regimen you are on so that you can have that sight preserved till old age. We love you, and bye for now. Bye. Thank you.